If you've ever left a doctor's appointment feeling worse than when you walked in, if you've been told it's just boils or probably ingrown hairs by someone with an actual medical degree, this episode is your permission slip to find better.
Oh, this one's personal for a lot of people. The stories I've heard and lived about doctors who just didn't get it. We could do a whole series just on that.
We're doing something more useful, though. Today, we're talking about how to find doctors who actually understand HS, how to build a care team that works for you, and how to advocate for yourself in a system that doesn't always make it easy.
Let's start with why this matters so much. The average HS diagnosis takes 7 to 10 years. 7 to 10 years of being told it's acne, it's hygiene, it's your weight, it's stress, when really it's a recognized inflammatory condition that has actual treatments.
And a lot of that delay comes down to primary care doctors just not recognizing it, which isn't entirely their fault. HS affects maybe 1 to 4% of people, and med schools don't spend much time on it.
But it means your first stop should usually be a dermatologist, specifically a dermatologist who treats HS regularly. Not all of them do.
This is key. Dermatology is a big field. Some derms focus on cosmetic stuff, some on skin cancer, some on autoimmune conditions. You want one who sees HS patients often enough to be current on treatments.
When you're calling to book, ask directly, does the doctor have experience treating hidradenitis suppurativa? If the receptionist doesn't even recognize the name, that might tell you something.
The good news is there are now HS specialty clinics at major medical centers. Johns Hopkins, UCSF, Mayo Clinic, Cleveland Clinic, they have dedicated HS programs. If you're near one, that's gold.
And if you're not near one, don't despair. There are general dermatologists who are really good with HS. You just have to find them. The HS Foundation has a provider directory on their website.
Let's talk about red flags, things that should make you consider finding someone else. Number 1, if they've never prescribed a biologic for HS, that's concerning. Biologics like Humira have been FDA approved for HS since 2015.
If a doctor's solution is always lose weight and keep it clean without discussing actual medical treatments, that's a red flag. Weight loss might help some people, but it's not a treatment plan.
If they seem dismissive or rushed, if they don't examine your lesions, if they minimize your pain, trust your gut. You deserve better. They validate that this is hard. They acknowledge the pain is real. They don't make you feel ashamed. Those things matter.
Now, a dermatologist is crucial, but HS often needs a team. Let's talk about building that team.
Your dermatologist is like the quarterback. They're coordinating the overall game plan. But you might also need wound care nurses if you're dealing with draining wounds or post-surgical care.
Mental health support. We talked about this last episode. A therapist or counselor who understands chronic illness can be invaluable. Your derm might have referrals.
For some people, pain management becomes necessary. If your HS pain isn't controlled with over-the-counter options, a pain specialist can help, though finding one who takes chronic pain seriously is its own journey.
For women, there's often an OBGYN component. HS can affect the groin and vulvar area, and hormonal factors play a role. Some women find their flares tied to their menstrual cycle. An OBGYN who communicates with your derm is helpful.
And don't forget your primary care doctor. They need to know about your HS, especially if you're on immunosuppressive biologics. They should be monitoring your overall health.
Let's get practical. The appointment toolkit. Things you can do to make your visits more productive.
First, track your symptoms before you go. There are apps for this. Violytic is one that's designed for skin conditions, or just use your phone's notes app. Write down when flares happen, where, how painful on a scale of 1 to 10.
Photos are huge. I know it feels weird to photograph your armpits or groin, but having a visual record of a bad flare, when you might be in remission during your actual appointment, helps your doctor see what you're dealing with.
Bring a list of questions. Seriously, write them down. In the moment, when you're anxious or in pain, you'll forget. What treatment options haven't we tried? What are the side effects? How long before we know if this is working?
And here's a big one. If you're dismissed or feel unheard, you have options. You can ask for their reasoning to be documented in your chart. Can you note that you're declining to prescribe biologics and your reasoning?
Sometimes that changes the conversation. Sometimes it doesn't. And that's when you get a second opinion. You're allowed to do that. It's your body and your health.
Second opinions aren't insulting your doctor. They're standard in medicine. Any good doctor understands that.
Now let's talk about navigating the system, because this is where HS care gets complicated. Insurance.
Biologics require prior authorization. That means your doctor has to prove to your insurance that you've tried other things first and that this medication is medically necessary.
This process can take weeks. It can get denied. If it gets denied, you can appeal. Your doctor's office usually handles the paperwork, but you should follow up and make sure it's moving.
If biologics get denied repeatedly, there are patient assistance programs. AbbVie, which makes Humira, has one. Novartis has one for Cosentyx. Your doctor or a patient advocate can help you apply.
Also worth knowing, telehealth is increasingly an option for HS care. If you're in a rural area or can't find a good local dermatologist, some HS specialists do virtual visits. Insurance coverage varies, but it's worth asking about.
The bottom line is this: finding the right doctor for HS might take some effort. You might have to advocate harder than feels fair. But the difference between a doctor who gets it and one who doesn't, it's night and day.
You deserve a doctor who takes your pain seriously, who knows the current treatment options, who sees you as a person, not just a skin condition.
It might take a few tries. That's okay. Don't give up. The right provider is out there.
Coming up in our final episode of HS Week, Community, Finding Your People, online and offline, and why hope isn't just a nice word, it's a survival skill. I'm Maya.
And I'm James. Thanks for spending this time with us. Take care of yourselves.
Until next time.
Before you go, a quick thanks to our sponsor, Violytic.
Violytic is a free symptom tracking app designed specifically for people with chronic skin conditions. You can log flares, track triggers, take photos, and see patterns over time.
It's actually really helpful for those doctor appointments we talked about. Instead of trying to remember when your last flare was, you've got it all documented. Photos, pain levels, what you were eating, everything.
Check it out at violytic.app. That's VIOLYTIC.app. It's free to download.
Thanks for listening, and we'll see you next time.